In this video, I'm going to be going over the skeletal muscles of the body. Skeletal muscles belong to the muscular system. In this picture, the skeletal muscles are represented in red color. In the body, the muscle appears red in color. It is definitely very much exaggerated in this photo. The skeletal muscle in reality is a lot lighter in color. Still has the reddish color to it because of the blood supply to the muscle, and also the red colored protein that is present in the muscle called myoglobin. Generally speaking, the word myo means muscle. So anything that you see that starts with the word myo in anatomy and physiology, that is going to be related to the muscle. In this picture, the muscles are highlighted in red. The muscles are located under the skin, so there's going to be a layer of skin, then there's going to be a layer of fat, and then that's when we're going to see this muscle. The reason why skeletal muscle is called skeletal muscle is because it is attached to the skeleton, to the bones of the body. The way the muscle is connected to the bones of the body is with these white connective tissues called tendons. So tendons by definition connect muscles to bones. You already seen the ligaments. Ligaments have a similar appearance and similar texture and material. Both tendons and ligaments are made out of collagen fibers, and the difference is that tendons connect muscles to bones and ligaments join various bones together. The muscles have kind of like this appearance. They look fibrous. They look like they have lines going in parallel to each other, and you can see the outlines of the muscle based on where the direction of the fibers kind of like overlaps and changes. So this is one muscle that overlaps another muscle in the body. So we're going to be going over the names of individual muscles, their location, and also what they do. We're going to start with the face. The face has a lot of muscles. A lot of them are used for facial expressions, but many of them are used for more than just expressing our emotions and feelings. They're also used for closing and opening our eyes, blinking, speech, and chewing, of course. The first muscle we're going over is frontalis. Frontalis is the muscle attached to the frontal bone. It is the muscle on the forehead. It is connected to the bone above the eyebrows, and also stretches across the forehead and connects to the top of the head. It's the muscle that can raise our eyebrows. And as you can see, frontalis muscle appears both on the right side and the left side symmetrically, and that's going to be true for most muscle in the body unless that muscle lies directly along the midline, and there's only like one or two exceptions. The next muscle is orbicularis oculi. The word orbicularis means it is circular, so this muscle fibers they travel in a circle along the body part, along the eyelids, so they encircle the eyes. Oculi means the ocular. This muscle is fairly thin, especially thin on the eyelid. It's probably the thinnest muscle in the body because the eyelids are very, very thin. This muscle is able to close our eyes, also to squint our eyes. Okay, next muscle. Next muscle has a similar appearance to the orbicularis oculi. This one is also a circular muscle, therefore its name orbicularis. This muscle encircles the mouth, the lips, so it's going to be under the nose, around the mouth, and under the mouth, like the top portion of the chin. This muscle is known as the pucker, like a kissy face muscle. It is used in closing our mouth and moving our mouth in various ways to produce speech and, of course, for chewing. The next muscle is called masseter. This muscle is the muscle on the side of our face, on the side of the jaw. Here you can see a little bit of the bone peeking through. This is the lower jaw bone, the mandible. It's going to be kind of like here. This is the mandible. And the masseter muscle is connected to the vertical portion of the mandible. It's called the ramus of the mandible. So this is where the masseter is connected. It is also connected to the cheekbone right here. This portion right here is called the zygomatic arch. This is the connection between the temporal bone. This is going to be temporal bone right here around the ear, and the zygomatic bone, the cheekbone. This is where they join together in the zygomatic arch, and that's where the masseter muscle is connected to. As you can see, it's overlapped by some of the other facial muscles, this zygomaticus muscle, and here it even has a muscle attached to it. And so masseter is a thick muscle. It is used for mastication, for chewing, so clenching kind of like our jaws together to grind food. Another muscle that is used for the movement of the jaw. So remember, when I say the movement of the jaw, that means the lower jaw, because the lower jaw, the mandible, is the only movable bone of the skull. So this muscle is called temporalis. This is a wide muscle that is connected to the temporal bone right here on the temples. It's got its fibers kind of like fanning out, so it's thinner, so it's more like a so it's more narrow down at this end, and then it like fans out over a large surface. The other end, the inferior end of this muscle is connected to the jaw, to the lower jaw. You cannot see it here, but it's going to be connected to the coronoid process. I guess I'm outlining it here. This is the lower jaw. This is where the temporomandibular joint is. It's covered by this ligament right here. Same zygomatic arch. So temporalis muscle is attached to the temple, then it converges, passes under this piece, the zygomatic bone, and then attaches to the coronoid process of the mandible. That will be right here. So temporalis muscle also helps with chewing. Generally speaking, when temporalis muscle is contracted, it keeps our mouth closed, so it keeps our jaw elevated. Okay, you can feel the action of both temporalis muscle and the previous muscle called masseter muscle. If you place your hand, your fingers right here on the side of your jaw, and also right here on the temple, and then you try to squeeze your teeth together, and then you're going to feel those muscles that kind of like twitching, moving under the skin. Moving down to the neck, of course, we're not going to go over like every single muscle in the face. We're just going to go over the major muscles in the face and the body, so skipping lots of the smaller muscles. Moving down to the neck, this is a big muscle in the neck called sternocleidomastoid. A lot of times muscles are named based on where they are connected. So as you saw, the frontalis muscle connected to the forehead, to the frontal bone. Temporalis muscle is connected to the temporal bone. This muscle is connected to 3 different bones. So it's connected to the sternum right here. This is where it's connected to the sternum. You can see the tendons. Cleido refers to the clavicle. Clavicle will be right here, a little bit not super represented well in this picture. And then mastoid is behind the ear connection, because the bone behind the ear is called the mastoid process of the temporal bone. So mastoid. So we got 3 connections of this muscle. It's called sternocleido and mastoid. Okay, so this muscle you can see fairly well through the skin. If you look at a person's neck, this muscle is the muscle that wraps around the neck from the side of the neck towards the front, and it forms this kind of like U shape at the base of the neck. We use this muscle to move our neck in various directions. For example, if you do the hyperextension, so tilt your head back, this is the muscle that's tilting your head back. It's kind of like lowering your head to the back. You can actually place your fingers on this muscle, and I'll try to do a demonstrational video later about this. And then when you lower your head to the back, so you're doing a hyperextension, you're going to feel this muscle contracting, so it's going to appear firmer, and it's going to be lowering your head to the back. And then the same thing if you go back from the hyperextension back to extension, you're going to feel this muscle lifting your head from the back towards the front. It's kind of like pulling the skull back towards the front. Okay, so let's review the muscles that we've covered so far. Frontalis muscle, the muscle connected to the above the eyebrows, to the frontal bone. It elevates the eyebrows, kind of like surprised, raising the eyebrows. Orbicularis oculi, the circular muscle around the eyes. It's involved in closing of our eyelids, so blinking of our eyelids, closing our eyes, also squinting our eyes. Another circular muscle around the mouth, around the lips, right under the nose, under the lower lip as well. Orbicularis oris. Oris means oral, so oris is the oral mouth muscle. This one is involved in closing our mouth and also puckering the mouth, kind of like the kissy face. The chewing muscles are masseter and temporalis. Masseter muscle on the side of the jaw, on the ramus side. Very strong muscle involved in mastication, hence its name, masseter. So sometimes muscles are named based on their function, not just location. Some muscles are named based on their shape, orbicularis. Also the location, oris, mouth, so shape, orbicularis, circular. Oculi, location, around the eyes. Masseter involves in mastication, chewing, right here on the side, connected to the zygomatic process and the ramus of the mandible. And then temporalis muscle is the muscle that looks kind of like a triangle if you were to describe its shape based on the geometric shape. So it's wider at the top and more narrow towards the bottom, kind of like fans out like a fan. This muscle attached to the temporal bone and to the coronoid process, overlapped here by the masseter, to the coronoid process of the mandible. And then the neck muscle, sternocleidomastoid, is connected behind the ear, and then it's a long, kind of like a cylindrical muscle that wraps around the neck to the front, connects to the sternum, and then to the clavicle. So all of this is sternocleidomastoid muscle. As you can see, it's overlapped by this another more superficial, thinner muscle under the chin and the front of the neck. And here's again these muscles. So quick review: frontalis muscle, orbicularis oculi muscle, orbicularis oris muscle, temporalis muscle, masseter muscle, and sternocleidomastoid in the frontal view of the full body. Next, we're moving on to the shoulders, chest, and back. So the muscles connected to the shoulder girdle. To remind you, the shoulder girdle is made of the scapula, the shoulder blade, and the clavicle, the collarbone. These bones join the arms to the body, so the appendages, the appendicular skeleton, are upper limbs to the torso. These muscles are going to be involved in the movements of the arms mostly, and of course movements of the shoulder and neck. Okay, so the muscles we're going over here is trapezius. Trapezius is the back muscle, but you can see it here on top of the shoulders from the front as well. This is trapezius, so it forms the tops of our shoulders. Also the back of the neck, I'll show you in the next picture. Deltoid. Deltoid is the triangular muscle on tops of our arms. So it forms this kind of like round appearance of our shoulders. So this is deltoid muscle. And then pectoralis major, or the pec muscle, is the muscle of the chest. So it's this also triangular muscle that forms the front of the chest and connects our arms to the front of the chest. Trapezius muscle is mostly visible from the back. It is connected to the back of the skull, along the vertebra, along the cervical and thoracic vertebra to the mid-back. Okay, and then it's connected to the shoulder blade. So I'm going to outline the shoulder blade for you. This is going to be the shoulder blade here. Shoulder blade is this triangular bone. It's wider at the top, and then it gets more pointy towards the bottom, towards its inferior point. And there's lots and lots of muscles connected to the shoulder blade. So one of the more superficial muscles connected to the shoulder blade is trapezius. So once again, trapezius is the muscle that's connected to the base of the skull, then along the cervical, along the thoracic vertebra to the mid-back, and then to the scapula. This portion of the scapula is referred to as the spine of the scapula. You can actually trace your fingers from the top of your shoulder towards the back, kind of like at an angle, and you'll feel a bone here, and that's called the scapula. Okay, that's the spinous scapula. Trapezius muscle is called trapezius because of its trapezoid shape. It's got 1, 2, 3, 4 sides. So it's got like 4 sides to it. I think I showed it incorrectly. Okay, so once again, 1, 2, 3, and 4. Okay, so 1, 2, 3, and 4. Okay, trapezius muscle is the muscle that it's involved in the movement of the neck. As you can see, it's located in the neck, in the movement of the shoulders, and in the movement of the arms. So if you tilt your head to the front, so do the flexion of the neck. Okay, this is trapezius muscle, lowering your head towards so your chin to the chest. So lowering your head towards the front, and then elevate your head back to extension. This is trapezius muscle, pulling your head to the back. So flexion, trapezius muscle. Flexus lowers your head to the front, and then extension, trapezius muscle, elevates your head back to extension. If you shrug your shoulders, so pull your shoulders towards your ears, up and down, this is also this part of trapezius muscle especially working hard, and that's the trapezius muscle, moving your shoulders up and down, elevation up, depression down. Okay, trapezius will also be involved in the movement of the arms. So if you do abduction, adduction, this part of trapezius is pulling your arms towards in the upwards direction, and abduction, like away from the body, and an adduction, lowering them. Okay, this part of the trapezius on top of the shoulders is the thickest. So when there's any muscle, the muscle will have a thicker portion and a little bit thinner sides. The thickest portion of the muscle will be called its belly. So this is going to be the belly of trapezius muscle. Other muscles will have bellies in various other places, and I'll show you other muscle shapes when we go over all the names of the muscle first. The next muscle is deltoid muscle. You saw it from the front, you saw it from the back. It's the muscle that is on top of our arms. It connects our arms to the shoulders. It's connected along the scapula. And if we go back one slide, it is also wraps around and connects along the collarbone. So this right here is a collarbone, the clavicle. This is another clavicle, and this is deltoid muscle connected along the clavicle and then along the scapula. Okay, and then all of its fibers converge into one spot right here, and this is the connection of the deltoid to the humerus. Okay, so deltoid is connected to the upper arm humerus and to the shoulder girdle, to the spinous scapula, and to the clavicle. The biggest motion that deltoid is, the biggest function of the deltoid is the movement of the arms away from the body. So for example, if you move your arms away from the body in the abduction, this is deltoid pulling your arms up, of course together with trapezius, and then when you lower your arms down in the adduction, this is deltoid lowering your arms down together with trapezius into the adduction. Okay. Deltoid and trapezius muscles are superficial muscles. There's actually a lot of muscles underneath them. There's a muscle group called rotator cuff muscles. These muscles are connected to the shoulder blade, and I'm actually outlining the invisible part of the rotator cuff as well right now because a lot of it is overlapped by the trapezius and the deltoid muscle. So rotator cuff is a group of muscles that are connected to the shoulder blade, to the scapula, and what they do is exactly what their name suggests. They rotate our arm. Okay, so bend your elbows, hold your arms straight down the body, then bend your elbows and try to move your hands into the body, towards the body, and then away from the body, kind of like you're opening or closing the door. So this is what rotator cuff muscle does. It like rotates the arm. Here's the muscles of the rotator cuff separated from the body. This is the frontal view. This is the back view, so anterior, posterior view. To orient you, here's the collarbone, the clavicle from the front, and this is the scapula, the shoulder blade bone. It is kind of a funny view of the shoulder blade because normally there will be a rib cage here blocking the shoulder blade, but we can actually see the side of the shoulder blade that is touching the rib cage, so it's like the anterior portion of the shoulder blade. This right here is humerus, the upper arm bone, and covered by the tendons is the shoulder joint here. And then the posterior view, same thing, you can see a little bit of the collarbone. This is the scapula, fully visible from the back. This is the spine of scapula, the portion of the scapula that rises higher above the surface of scapula, and this is the humerus, the upper arm bone. Okay, so from the back, above the spine of scapula, so superior to the spine of scapula, there is a muscle. It's actually connected to the humerus and to the portion of the scapula above the spine of scapula called supraspinous fossa. This muscle is called supraspinatus. Supra means above, spinatus, spine. So supraspinatus muscle right here. It connects the area of the scapula above the spine of scapula to the head of humerus. The head of humerus is this round portion of the humerus bone that forms the shoulder joint. The next muscle is below the spine of scapula. It is also connected to the head of humerus by its tendon and then to the rest of the scapula. This muscle is called infraspinatus, means below the spine of scapula. Below the infraspinatus, there's a smaller and thicker muscle. It's connected to the angle, the pointy part of the scapula, and to the head of humerus, right below the infraspinatus. This muscle is called teres. If you flip the scapula around, you're going to see the underside of the scapula, its anterior portion. This is the muscle called subscapularis. It's connected to the underside of the scapula and also to the head of humerus. So sub means under, scapularis, scapula, subscapularis. So all of these muscles of the rotator cuff, they connect to the scapula with one end and then to the head of humerus with their other end. Visible here a little bit is the portion of the supraspinatus. This is the same muscle, just visible from the front or from the back. Okay, stay on the back. The next muscle is the muscle of the mid and lower back called latissimus dorsi. Latissimus means wide, dorsi means dorsal, in the back. This muscle is slightly overlapped by the trapezius, but it connects to the lower thoracic vertebra, lumbar vertebra, and also the sacrum. Then this muscle fibers wrap around the whole lower and mid back and converge into a point that is connected to the humerus. Okay, the humerus is the upper bone, kind of like to like a little bit above the middle of its shaft. So latissimus dorsi is the back muscle. The easiest way to imagine this function of the muscle is to imagine this exercise called bear crawls. So it's crawling on kind of like, I guess you can crawl on the ground with your arms wide and bent and kind of like trying to like grab the ground and pull it towards you, like crawling, maybe like climbing the wall, climbing like a like a ladder, just holding onto the edges of the ladder and pulling yourself up. So it's also known as the swimmer stroke. So if you're swimming, you're going to pull your arm to the front, but then you're going to pull it to the back of your body, creating a power stroke. So that's the muscle used for this power stroke.